We have here a 10-and-a-half-year-old golden retriever down for a dental procedure. He's 10 and a half years old, had a normal physical exam, including his heart and lungs. Everything sounded great there. And pre-surgical blood work we did beforehand looked great, so no problems with him under anesthesia. We've done one side already, flipped over to the second side. He's been doing really well under anesthesia. You can see here that he's connected to our anesthesia machine to keep him under for the procedure. It is connected to his endotracheal tube. This goes straight into his lungs, and there is a little balloon down at the end of the endotracheal tube, somewhere down about in here, that we inflate to both keep oxygen and isoflurane gas in his lungs, and most importantly, to keep all the water and liquid and everything from going down into his lungs to prevent aspiration. Super important in our dental patients. Under anesthesia, he is being monitored here for his ECG or electrocardiogram, his pulse rate, his oxygen saturation, and then his blood pressure here and his temperature. Everything's looking really good so far. We also have the capability of monitoring for carbon dioxide output, which is very important. However, the sensor is a little bit sensitive to water, so during the dental procedures, we're not actually able to hook it up. Just as a safety precaution and to help with the procedure, we also have an IV catheter placed for direct venous access should any anesthetic emergencies arise. But as I said, he's been doing really good so far. Everything's been looking great under anesthesia, so we're going to proceed. I'm going to show you what it's like to clean one tooth, and then we'll finish up, and you'll have a good idea of what a pet gets for a dental procedure. So, we'll come over here, lift up his gums. You can see a lot of cruddy brown looking stuff right along here, especially on these big back teeth. This fourth premolar and these first molars are some of the favorite places to get it, but you can see it along some of these teeth as well. And especially in little dogs, you will see it spread out throughout. If you look closely along the gum line, you can see a nice red line right along the gum line, a difference between the gum tissue up here and right along the gum line. That's indicative of a minor infection, some gingivitis, some low-level periodontal disease, and that's what we're treating with this. So what I'm going to do is take the scaler, just like at your dentist, and I'm going to scale the surface of this tooth, get all that brown, nasty stuff off of there, which is the tartar, and underneath that is where the bacteria is lying that causes this infection, and get up underneath the gums really good. And we'll follow that up with a polish, and we'll be done on that tooth. So I'll get started. As we're cleaning all that yucky stuff that's coming off of there, that's where a lot of your smell comes from. Like I said, under that, a lot of dental disease causing bacteria. Always keep close moving. You never keep it on the top for too long. It can't stay on the tooth for too long. Damage the teeth is probably not. Come back here. That's going to be good zone through as well. A lot of bacteria likes to hide. It's last sometimes, especially in our older patients, you will see some areas of enamel loss. Even after cleaning, it still remains brown. Sometimes right kind of in between the teeth or in these little crevices. And that is normal. It's not part of it. Just about got that one done. And then, just like at your dentist, we will polish the surface of that tooth, removing any grooves that we had just created and any that were there from normal wear and tear to prevent tartar accumulation as much as we can. We'll rinse that tooth off so you can see. Much cleaner. You'll see that red line along the gum line is still there, and obviously that infection doesn't clear. What we are trying to do with these dentals is prevent that from progressing further. When it does, you would start to see a lot of gum recession where the gum tissue actually recedes away from the tooth. And that could be indicative of some more significant periodontal disease, which is what we're trying to prevent with these procedures.